Welcome to The Explainer. Today, we're looking at a fascinating paper straight from the 2023 issue of Bioelectromagnetics. The title is, A Novel Non-Surgical Therapy for Peri-Implantitis Using Focused Pulsed Electromagnetic Field. Look, as dental professionals, we absolutely know the high stakes here, right? Peri-implantitis is brutal. It leads to severe bone destruction and ultimately, that devastating implant loss if we just leave it unchecked.
So, that brings us to a massive question for our field. Can we predictably reverse peri-implantitis without going to surgery? You know, we all know the limitations of current mechanical debridement. I mean, sure, it cleans the surface, but it really struggles to consistently regenerate bone and fully resolve that complex inflammation all on its own.
Okay, let's dive into this. This peer-reviewed pilot study by Dr. Mayer and colleagues, it's honestly a potential breakthrough for our daily dental practice. It explores an entirely new way to tackle the problem. We're moving way beyond just mechanical scraping here to actually modulating the body's own natural healing response right around the implant.
Section 1. Testing PEMF therapy, a novel approach.
Let's look at the methodology and define our core terms before we hit the patient data. First up, PEMF. That stands for Pulsed Electromagnetic Field Therapy. And you know what's amazing? Orthopedics has actually used this for decades for those stubborn non-union bone fractures. So bringing this tech into dentistry, it's incredibly grounded and frankly remarkable. Now to deliver this directly into the mouth, the researchers used an MED. That's a miniaturized electromagnetic device. Basically, it's a novel healing abutment that generates that active PEMF.
So here is how they set up this double-blind clinical trial. 23 patients with diagnosed peri-implantitis were split right into two groups. The control group, they got the standard mechanical debridement plus an inactive, basically a sham, abutment. But the test group, they got the exact same mechanical debridement, but their abutment was an active MEAD. This was delivering the PEMF therapy continuously for a full 30 days.
Section 2. The clinical findings. Now, what's really interesting about this is
how clear the results are when we actually track the data. Look at the control group. Their crestal bone levels started at 3.63 millimeters, slipped to 3.73 at 1 month, and by 3 months, it actually worsened to 3.75. I mean, basically zero bone regeneration. None. But then look at the test group. They started at 2.84 millimeters, improved to 2.48 at the 1 month mark, and hit a statistically significant 2.39 millimeters by 3 months. That is huge. And we see a similarly progressive success with the periodontal pocket depth. For the test group, it shrank steadily from 5.58 down to 4.06 and finally rested at a much healthier 3.45 millimeters.
Notice that stark contrast at the 3-month mark. The active PEMF therapy clearly facilitated tangible, real bone regeneration. It pulled the bone level to an impressive 2.39 millimeters. Meanwhile, the control group just stalled out and lost ground at 3.75. It's like night and day.
And these clinical findings, they were completely backed up by some deep immunological data. We all know that inflammation drives bone loss, right? Well, early on, at just the 2-week mark, the key inflammation marker IL-1 beta in the peri-implant curvicular fluid absolutely plummeted in the test group. It dropped down to 72.86 picograms per milliliter, compared to nearly 112 in the control group. The PEMF literally cooled down the inflammatory response. Section 3, your daily practice, clinical takeaways. And this brilliantly illustrates
The real-world value here. The big takeaways are predictability and preventative dental care. By combining standard debridement with an active MED, you are going to achieve much higher predictability in your non-surgical peri-implantitis therapy. It's a real game changer. Plus, it seamlessly enhances your preventative dental workflows because that additive PEMF healing effect, it lasts for 30 full days. It's working continuously around the clock without requiring any extra patient compliance whatsoever. It just significantly improves your clinical parameters over debridement alone.
This is honestly a technology that actively changes the landscape of implant survival. So, follow Magdent on Instagram and LinkedIn at Magdent MED and visit magdentmed.com to book a demo. Scan the QR code, bring this incredible MED technology into your practice, and give your patients the future of implant care. I mean, think about it. Will traditional mechanical-only scraping soon become a thing of the past in your clinic?